What is the treatment of massive haemoptysis? Massive haemoptysis. Treatment of massive haemoptysis. Massive haemoptysis in which the amount of blood coughed out is more than 100 ml in 24 hours, and the massive haemoptysis is a life-threatening emergency with mortality of up to 80%. It's extremely distressing for the patients, relatives, and medical staff, but is fortunately rare. Investigations will follow treatment, which may be difficult and is often unsuccessful, and in some cases, active treatment may be inappropriate, and the palliative treatment with oxygen and opiates may be warranted. The management of massive hemoptysis or treatment of massive hemoptysis include airway protection and ventilation. Protection of the non-bleeding lung is vital to maintain adequate gas exchange, and this may involve either sitting the patient up or lying on the bleeding side. Again, because this is a very important point, you should uh, uh, make the patient sitting up or lying on the bleeding side in order to prevent blood from flowing into the unaffected lung. And sometimes intubation with double lumen tube is used, and if intubation is needed or appropriate, we give high flow. If intubation is not needed or not appropriate, we should give high flow oxygen. After airway protection and ventilation, the second important step in treatment is cardiovascular support. We should insert a large bore or central intravenous catheter and doing cross-match blood and resuscitate with fluid minus positive or minus blood transfusion, correction of the clotting by vitamin K 10 mg once daily, and consideration of platelets. Also, inotropes may be required. Then the other steps of treatment include nebulized adrenaline by dose of 1 ml of 1 to 1000 ratio made up of 5 ml with normal normal saline or sodium chloride 0.9%. Then oral or IV tranexamic acid 1 gram TID, but be careful in renal failure, especially if severe. It will not be, the dose should be monitored or the dose should be low. Then IV teripressin 2 mg intravenously, then 2 mg every 4 to 6 hours if continued bleeding is there. The chest X-ray, minus or positive chest CT, depending on stability of the patient. Early bronchoscopy, which is diagnostic and therapeutic. Rigid bronchoscopy with general anesthesia is preferable. It may allow localization of the site of bleeding and consider balloon tamponade with a Fogarty catheter. Ballonic tamponade with a Fogarty catheter. Then bronchial artery embolization, therapeutic approach to embolize bleeding artery, usually with coils or glue, and this will be used or will be tried in a specialist center only. Then the last option of treatment is surgery, which includes resection of the bleeding loop if all other measures have failed.